Welcome to a Legendarium special about Robert Liston, the speediest surgeon in Victorian Britain. Robert Liston was born in Ecclesmachan on October 28, 1794, the son of Margaret Ireland and her husband, the Reverend Henry Liston, a clergyman and inventor. After an early education from both his father and in Abercorn Village School, Liston studied medicine at the University of Edinburgh beginning in 1808 at the age of 14. In 1810, young Liston became an assistant to his tutor, Dr. John Barclay. In 1816, he traveled to London for a year to train under William Blizzard, then returned to Edinburgh to teach anatomy. Even at that young age, Liston distinguished himself enough for Blackwell's magazine to name him the first Northern anatomist. While living in Edinburgh, Liston confronted fellow Dr. Robert Knox over Knox's mistreatment of a young woman named Mary Patterson. After Miss Patterson's death, Knox pickled her in whiskey and put her body on humiliating display to gawking onlookers. Later, the police learned that body snatchers murdered Miss Patterson. While Liston devoted much of his time to instructing the next generation of doctors, he also performed surgeries himself. Unfortunately, Liston lived and worked at a time when a poor understanding of illness hampered physicians. Some doctors still believed that removing a few pints of blood from a patient would relieve ailments, despite the complete absence of evidence that it did so. More humane doctors cleansed the body through laxatives or inducing vomiting. Alongside folk remedies, physicians used dangerous substances like arsenic, opium, and cocaine. Not for nothing were early Victorian pharmacies known as kill-em-quicks. Miasma remained the prevailing theory of disease transmission. It argued that noxious bad air carried sickness. However, other supposed causes of illness included diseased parents, night air, laziness, anger, wet feet, and sudden changes of temperature. Physicians believed that cholera, soon to be epidemic in British cities, to be caused by cold fruits like cucumbers and melons. Because surgeons did their bloody work without anesthetic, many patients refused to enter operating rooms and left. They chose to suffer and probably die rather than go through the ordeal of surgery while wide awake. Thus, men of Liston's time measured the success of an operation by the speed with which the surgeon performed his bloody business. Quick surgeries meant less suffering for the patient and thus a higher probability of their surviving. Because he learned to remove damaged or diseased limbs with extraordinary speed, Robert Liston became a revered and admired doctor. Robert Liston is said to have once removed a limb and sewn up the stump in 30 seconds from start to finish. However, 2 minutes appears to have been his regular time. His surgeries became public events, with onlookers crowding around to watch the master at work. Behind a partition, men and medical students packed together tighter than herring in a barrel. Onlookers often shouted, "Heads!" if those in front of them blocked their view of the show. Whenever he started, Liston shouted to his students, "Time me, gentlemen, time me!" Surgeon Richard Gordon described Liston's surgeries as such. "He sprung across the blood-stained boards upon his swooning, sweating, strapped-down patient like a duelist, calling to students craning with pocket watches. Everyone swore that the first flash of his knife was followed so swiftly by the rasp of saw on bone that sight and sound seemed simultaneous. To free both hands, he would clasp the bloody knife between his teeth." Unlike most surgeons, Liston always changed his operating gown after each surgery. During Liston's time, surgeons took pride in wearing dirty, blood and pus-stained operating gowns as a display of their experience in the surgical trenches. They also believed pus to be a natural part of the healing process rather than a sinister sign of sepsis. Unsurprisingly, most deaths occurred because of post-surgery infection, and through this cleanliness, Liston ensured a significantly lower mortality rate among his patients, though occasionally Liston's dedication to speed caused grief. In his haste to amputate a man's gangrenous leg, he accidentally removed his testicles too. One oft-repeated tale, and one told by credible sources, told of a Liston surgery with a 300% mortality rate. While removing a patient's leg, Liston took off the finger of an assistant who held down the patient. Both the patient and the assistant contracted an infection, likely from Liston's dirty blade, and died. An elderly doctor observing the surgery became the third casualty. Liston's scalpel sliced into his tailcoat, and since blood was flying around, the old man thought Liston cut him, and he collapsed to the floor. Apparently, the poor old man died of shock. Nonetheless, Liston must be regarded as a great success. In 2012, General Surgeon Bill Thomas wrote in the Bulletin of the Royal College that Liston performed 66 amputations between 1835 and 1840. Only 10 of his patients died, a mortality rate of less than 1 in 6. At the time, the typical surgery room sent 1 in 4 to the cemetery. For that reason, patients camped outside Liston's waiting room in the hopes that he would consider them for surgery. Despite his achievements, Liston failed to attain a full professorship at Edinburgh University in 1833. Shortly afterwards, he relocated to London and lived at 5 Clifford Street in London's Mayfair neighborhood. There he became known as the fastest knife in the West End. In part because of his utter dedication to medicine and teaching medicine, Liston showed little interest in women and lived as a bachelor. However, he did leave a remarkable legacy behind. Liston invented several medical instruments, including a splint used until recently to deal with fractured femurs. He also wrote several articles about removing tumors from the mouth and throat. On December 21st, 1846, Robert Liston performed the first operation in Europe using ether anesthetic that had been developed in the United States. He called it the Yankee Dodge and praised it for relieving the excruciating pain of surgery. Thus, the surgeon who lived and worked when the medical community prized speed as the best means to relieve pain saw the birth of modern anesthesiology, which ensured that speed like his would no longer be needed. On another occasion, a child with a neck mass went to see Liston. Believing it to be an abscess, Liston cut into it only to learn that the swelling was in fact an aneurysm, and the boy tragically bled to death. In a morbid coincidence, a burst aneurysm killed Robert Liston on December 7, 1847, at the age of 53. His funeral procession included 5 mourning coaches and 15 private carriages driven by extended relations and his fellow doctors. Near the cemetery, 400 of Liston's former pupils met the cortege. They laid him to rest on the western side of Highgate Cemetery, thus ending the life of one of the best surgeons in Victorian Britain. That wraps things up for this episode of The Legendarium. I hope you enjoyed it. If you did, press like. If you want to see more, press subscribe, and if you've got anything to say, let me know in the comments section. Thanks again for joining me, and I hope that you have a great rest of the day.